I thought we'd kind of wind up our discussion today with thoughts on 2025. It seems like it might be a wild ride. And any thoughts from both of you on kind of areas that might do well this year? Um, Bryan, what are you guys thinking? Where are you placing most of your bets this year in the healthcare space?
I think we're certainly in for a wild ride. And just given the amount of statements from various parties right now, that kind of whether or not they're going to come to pass remains a question. One of the areas I'd say that we're seeing that is somewhat insulated from those statements has been med tech. And so that's kind of an area that we've seen it as a relative safe harbor within healthcare from kind of the rhetoric that's being thrown around in terms of reimbursement rates as well as prices. They're not necessarily in the crosshairs. But I think, when it comes to other areas of healthcare, we are really excited. Both, obesity is obviously a theme that we've seen the market recognize over the past few years, and that's been really exciting for us to see play out. But one of the things that we're expecting is really the next revolution with oncology drugs, both from the demand from an aging population resulting in higher rates of cancer, as well as kind of the revolution in treatment that we're seeing with these antibody drug conjugates. And so
Okay.
within
Yeah.
our portfolio, that's AstraZeneca is really kind of focused on that with their medications like their Dato-DXd, which is for lung cancer, as well as Enhertu, which is for breast cancer. Both of those are ADCs, and we're really expecting that ADCs are kind of the next really revolution in terms of cancer therapy, with being able to both reduce the negative side effects as well as improve the efficacy. So that's
Yeah.
something that
Precision.
we're really excited about. There's a number of trial readouts this year that are going to be coming out for those ADCs. And those should really continue to be developed over the next few years with moving into earlier lines of therapy, which is really exciting.
Great. And John, we can't equity investors can't invest in Vivus right now, although
Right.
it seems like you guys would be a great one. Perhaps in the future
Yeah,
that would
appreciate
change.
that. Appreciate that.
Um, but I think probably the viewers would like to hear your thoughts in terms of what you're seeing out there that might be, something to pay attention to in 2025, maybe outside of what we've already talked about, based on your perch, having been in a whole wide variety of different therapeutic areas.
Yeah. No, so I would echo Brian's comment around oncology. I think oncology is, obviously cancer is a horrible disease, but, with the advent and as pricing around, genetic testing around tumor management from a pathology perspective, you're
Mm.
able to identify pharmaceuticals that will treat that specific cancer much more accurately in the past. I think AI, I am aware of a number of projects in the AI space, in oncology specifically. A lot of them are on the drug development side. One or two of them, which I find really interesting, are on the kind of patient recruitment and trial design side. So kind of adaptive trial designs. And so physicians and oncologists are going to be able to use AI to augment their decision-making process. Probably still a few years away from it, really being, from a wide scale adoption. But I'm starting to see little pieces of it pick up. And I think this year and next year are going to be 2 years that you see a lot of investment, a lot of hype around it. So it'll be tough to, separate the wheat from the chaff. But, the NCI Cancer Centers, Moffitt, in particular, is very focused on, trying to build out this new type of adaptive trial design, which I think is fantastic. And
Yeah.
so, and then I think the final point that I would make is that there's a number of academic institutions that are actually building their own venture funds. And
Hmm.
so you're starting to see them invest in some of their technologies and their
Hmm.
portfolios, cross collaborations across the NCI cancer centers. Some of the decisions around, how much drug development, NIH funding, that's going to change that potentially. But it'll be interesting to see that over the next, year and a half, with the new secretary coming in.